Atlantic Path is a research study, and it's one of 5 similar research studies across Canada which together create the Canadian Partnership for Tomorrow's Health. Atlantic Path is the Atlantic Canada component of the Canadian Partnership for Tomorrow project. It's a research project which is going to involve 30,000 Atlantic Canadians. It's important that this pan-Canadian study has a representation from Atlantic Canada. Really important for several reasons. One is that we're really special in Atlantic Canada. There's 3 million of us living here in the 4 Atlantic provinces. Some of the issues around that we're looking at in the cancer study are particularly relevant to Atlantic Canada. We have the highest rates of cancer in the country. Atlantic Path is also going to look at other diseases, and many of those other diseases are also disproportionately high in our population. We have really high rates of heart disease, really high rates of diabetes, multiple sclerosis and other diseases, and one of the things is that we know that some of the risk factors for those diseases are also high in Atlantic Canada. Atlantic Path is part of the biggest and most ambitious cancer research project ever undertaken in Canada by a long way. It's really important because of its size, and size is important because of how different we all are. And so that to be able to make some conclusions which are generalizable to everybody, you have to have a bit of everybody in it. The other thing is its scope. So we ask people to tell us information about their health and their lifestyle and where they've lived and where they've worked and that sort of thing. We take biological samples. The minimum we take is blood, but we also, when we're able to, because it's a very complex study to mount, we also ask people to provide us with saliva, urine and toenails as well, so that we can measure those environmental contaminants in that. So in the next 5 years we will understand what the disease burden is of our population, who's got what. We will understand who's exposed to what in their environment. So we're looking at water, we're looking at toenails, we're looking at air quality, we're looking at where you live, and by linking in with other national studies we can produce we will be producing a good profile of the environmental exposures that you may have been exposed to at home or in your workplace. As an individual, we our genes and our omics, the function of our genes interacts with our environment and our background and our lifestyle to determine whether we're going to have a disease or not a disease. The average Canadian is going to care about this research because the findings in this research will be relevant to the average Canadian. The average Canadian is somebody who lives in Canada, who has lifestyle issues, who has family history, who has a life history, who at some stage is going to experience personally or in their family a chronic disease. The information from Atlantic Path will be directly relevant to them and to their desire that their children and their children's children and their children experience the best possible health trajectory through life.